Hi, welcome back to Elements in Focus. My name is Aaron Rheaume. I'm the Director of Financial Planning. As always, I've got Grant Soliven, our Manager of Advisor Operations, with me. If you're new to Elements in Focus, Grant and I will go through our 5 critical elements each Friday and break them down one by one. Specifically this week, we're talking about tax planning, and what we want to do each week is give you an idea or give you some information that may spark some thought that will push you into action. And so tax planning that we're talking about this week specifically is revolved around Affordable Care Act, especially pre-Medicare.
Yeah.
What do we mean by that?
And so this is a funny topic, Aaron. So some of you may be going, wait a second, why are we talking about Affordable Care Act in tax planning? Shouldn't that be risk management, all that other good stuff, guys? You just talked about open enrollment a couple, weeks ago. Why is this here? Well, for many of our families, they're not necessarily waiting until FRA, their full retirement age to retire. Sometimes they're retiring a little bit before Medicare age. And so if this is you, if you're in that preservation stage, distribution phase, and you're looking at exiting the workforce and using your assets the way Aaron and I have walked you through in all these videos over time, you may be going before Medicare. And so tax planning actually impacts your Affordable Care Act premiums substantially. But if you want to take a step back and look at when the Affordable Care Act was initially released many, many years ago, if you were going to get any what we called credits or premium subsidies, is another way to look at it, you had to be living in an extreme poverty, right, to get those. And over time, that's adjusted. So they're now bracketed based on your tax filing status and your income. And so looking at tax planning, there's many families we work with today who we're crafting income distribution and tax planning around helping them make sure that their medical premiums aren't crushing them prior to Medicare. And there's actually a lot of good tax planning that can be done in the Affordable Care Act stage between early retirement and Medicare so that you can actually have reasonable health care and not be paying $1,100, $1,200, $1,400 in premium, sometimes worse than COBRA, just to get it to Medicare. And so there's ways you have to structure the assets and distributions. There's ways we have to use assets that we may have not maybe thought prior. We have to delay certain things, Social Security, for example, maybe even some pensions, depending on the cost analysis and doing so. And so we want to bring this up to you because if you're an individual or a family who is about to engage in your life after work, retirement, and we haven't quite hit Medicare age, tax planning is going to become so critical for you, especially as we're planning around a lot of these premiums. So we just want to put that nugget out there because tax planning and Affordable Care Act do run and coincide with each other hand in hand.
Yeah, so to summarize, and let me make sure that I understood this correctly, what Grant is saying is, let's say I'm 61 years old and I am thinking about retirement, but that bridge between my retirement date and Medicare is 65, correct?
Correct.
So there's a 4-year window where you may have to do something different for your health coverage if your employer doesn't offer for you to continue that on as a continuation of benefits.
Right.
And what Grant is saying is there's ways that we can structure income around you potentially retiring early and going on Medicare at 65. A lot of planning has to be done around that. Again, it goes back to what we talk about often is figuring out what that standard of living is. And once we know what that standard of living is, then we know how to design an income stream around meeting that. And again, from an Affordable Care Act perspective, Grant mentioned this earlier, how that works now is you get 400% of what the deemed poverty level is that income threshold. And so there's things that we would pay attention to when we're helping you craft that strategy. But if you do have questions and you want to know more, can I retire early and not delay to 65 because you have saved well and you've got a huge concern about what health insurance looks like for a period of time, and it may be delaying you from retiring sooner rather than later, please reach out to us. Schedule your complimentary next steps meeting. You can call us at 800-928-4001. If you have a question, send it to talktofeg@yourlifeafterwork.com. There will be an advisor here to help you and help guide you to make sure that you're making the best financial decisions that you can. Thank you so much for watching our video. You have a blessed week.